Hi and welcome, friends, to HealthWise, the TV show. I'm Ralph Hipp. You're probably seeing those signs in the stores, the advertisements encouraging you to get your annual flu shot. We're into the peak flu season now, generally going now through May, possible to see cases even earlier. Katie Burenheide Foster is with Stormont Vail Health Pharmacy. She's a clinical manager there, helping us all get ready to battle the flu. Katie, we could talk about this every week on our show right about now. Good to have you here.
Thank you.
We've often heard people say, oh, well, I already had that. I had the stomach flu, but that isn't what we're talking about, is it?
No,
how do we define influenza?
Exactly. We're talking about influenza or respiratory flu. So similar symptoms might be cough, cold, chills, aches, sometimes a fever. And you feel sluggish, you just don't feel quite well.
So obviously the flu is something we should be very concerned about. It really puts a beating on us when we're older.
Yes, it can. And not just when you're older, but also the very young, like babies and infants, because their body's just not is susceptible to more things in the community, virus and so forth. So they can become really sick, especially in the older population.
Right. I did have at least one person come up to me and say, well, I don't get flu shots, they give me the flu. Don't you get that a lot?
Yes, we do, actually.
You don't get sick from getting the shot,
no,
right?
What
Remind
happens,
us about that.
What happens a lot of times is you may have been already exposed to the influenza virus itself, so when you get the shot, you might think it's a shot, but it's not. You probably had a touch of the flu to begin with.
What are some of the complications that would signal, oh, I've got it?
Well, if you have some of the complications for the flu, if you don't get it treated, and if you don't get the flu shot, is you can get pneumonia, which can cause hospitalizations. But one thing we're really concerned about is people can die from having influenza as well.
They sure can. What puts us at greater risk of contracting influenza, especially if we don't protect ourselves?
Yes, people who are at higher risk to get influenza are people who have like diabetes, heart problems, again, the very young, pregnancy. Women are pregnant, if they have a baby, they cannot have the influenza shot till they're 6 months old. So it's really protecting a lot of those individuals from getting the flu.
Melissa Bruner, who does our fantastic 2-year health reports, and she does at least a couple of reports about flu shots and influenza. And I know we always keep track every flu season, Katie. What are the strains that are out there? And what is the vaccine? Has it been adjusted for the strains that we're most susceptible to getting this year?
Yes, it is. Every year they do look at the strains that are out there. And currently there's 2 A viruses and 2 B viruses that are in the vaccines.
2A and 2B.
If you get the quadrivalent. If you only get the trivalent vaccine, there's only 3 viruses, which is the A and the B, which are all inactivated viruses.
Right. What's the best way to get a flu shot? You have some ideas on that, and one of the reasons you're here.
Yeah, Stormont Vail has a lot of opportunities where you get your flu shot. There's a drive-through flu shot. There's also express cares, walk-in clinics. You can always ask your provider, but there's also, you can go to stormontvale.org, and they have a lot of information there as well.
So there's no excuse not to get it. I mean, we could walk in or drive through, for heaven's sake, and get the flu shot. And be protected. How long does the protection last on a flu shot once we get those?
That actually is fairly new in the last couple of years. They used to say to get your flu shot later on in the fall so it can cover you during the winter, but now they say to get it as soon as possible, especially before October, and that should last for the entire season. October
through May, would you agree with that? It's about 7 months?
Yeah, you can get it now, but definitely by October. And if you just happen to forget and get it in November, December, it will still give you protection through May.
Right. Talk about the cost of it.
The cost of the
if it's covered, and how much would it cost, and include that in our budget to help take care of ourselves.
A lot of insurance companies do pay for the influenza shot, and usually if you have to pay for it, it's a nominal fee at different locations and pharmacies.
If someone says, I really, I never get the flu, I don't need the flu shot, what would you say to them?
It may not affect them as much if they get the flu every year, but if they get the flu shot to protect others around them, because if you're sick, you should stay home. You should be out in the community, which also reduces number of work days or school days you miss.
Right. How about for our school kids? If we're busy working and they're busy in school, is the clinic open in the evenings? How would we protect our kids, or if we have a busy work schedule as moms and dads? And also if our parents, the grandparents to those younger kids, they rely on us to transport them around. is there a way we can get them after 6 or 7 o'clock in the evening as well?
Yes, we do have a lot of different opportunities, not just in the day, but also in the evenings. And I suggest, again, go to stormontvail.org. There's a pediatric clinic, has a lot of different times they can go and get shots, not just the pediatrics or kids, but grandmothers, parents, you name it, as well as a lot of the express cares as well.
Right. Well, let's show information at home and take a look at these, and we hope this is convenient for you. Katie, would you like to tell us? So there's the phone number right there, and at stormontvale.org, we always ask, when they call this number, who would they be talking to?
Well, when they call the 785-354-6789, they'll be given all the different flu shots and clinics that are available throughout Topeka.
And at stormontvale.org on the website, can we sign up to make an appointment to get a flu shot online?
You can, if you have My Chart through Stormont Vail, you can sign up there to get a flu shot. But I suggest, if you can, go to one of the walkthrough clinics or express cares. There's a lot of different ways you can get it, or seek your provider.
Right. Where are you located, Katie? Which clinic are you in, the clinic locations around town?
I'm actually at Stormont Vail Hospital, but we do have a medication clinic and provide flu vaccines on Wednesdays at HealthWise.
Okay. And on that website, that's stormontvale.org, can we also research, can we read and learn more about the flu strains that are out there and more reasons why we should get our flu shots?
Yes, you can definitely go to the CDC website. Just type in CDC influenza, and they keep all the information up to date every year.
So the CDC website, of course, I would imagine any conceivable question you have about flu and getting flu shots, because I think I've gone through my entire list. I think you've done a great job answering all these. And Katie Burenheide Foster, thanks, and get your flu shot, folks. And I'll be getting mine soon. We love to do ours here at the station, so that'll be happening very soon, I'm sure. But Stormont Vail at those clinics, it'll be fantastic to get that and be protected for the flu season. Well, here's something we'd love to remind you about, and for the final time or two, HealthWise is hosting those monthly senior suppers at Stormont Vail Hospital the second Mondays of October and November, and you're invited. Get those final few tickets. Your $5 dinner is served at 5:15, followed by a speaker about a health and wellness topic of interest. The number to call to sign up for the suppers is 354-5225. Time now for our HealthWise TV, our exercise segment. Have some fun, invigorating, low-impact exercises. Be sure to check with your doctor before you start this or any program.